I am Clarice Grody. I'm an occupational therapist, Medicare specialist, and the founder of Amplify OT. And I'm here to give you an update on advocacy initiatives for occupational therapy practitioners for the fall of 2022. Now, I do want to remind everyone that today is November 17th, Thursday, and it's around 2:00 p.m. Eastern. So if you are watching this after this, I do want to have a disclaimer that things may change. Things tend to happen very quickly when it comes to legislation. So there is a possibility that by the time you're watching this video, it may be out of date. But as of right now, this is the information that we have. Okay. So I first want to talk about a little bit about who is supporting advocacy efforts when it comes to occupational therapy. Obviously, we have our wonderful occupational therapy advocates, which is you and everyone around you who tells everyone about occupational therapy, advocates to our legislators, but this is the groups that are supporting us in terms of AOTA. So in AOTA, we have a federal affairs team, a state affairs team, regulatory, quality, and then also the American Occupational Therapy Political Action Committee. So our federal affairs team is our primary group that's lobbying Congress. So they're going to meet with our legislators and talk about our issues and really support a lot of the initiatives that we're talking about today. The state affairs team, pretty self-explanatory. They deal with a lot of the issues going on within the state. So like your Practice Act and Medicaid and those sorts of issues. Regulatory team tends to do a lot of the work of what happens after a bill passes Congress. So as a quick civics 101, bill has to go through Congress. It has to pass the United States House of Representatives, the United States Senate, and then after that, it may go through a rulemaking process if it's a Medicare policy. So once it goes through Congress, it then goes to CMS to go through a rulemaking process, and the regulatory team helps take care of that. So basically, they deal with the regulations. Our quality team, obviously involved in quality. So they do a lot of advocacy work around making sure that occupational therapy practitioners and services are included when looking at quality metrics and really kind of evaluating what does quality care look like when we're dealing with occupational therapy. And then American Occupational Therapy Political Action Committee, this is a PAC. And so it works collaboratively with AOTA and with the federal affairs team to support advocacy initiatives through congressional campaigns. So you can find out more information on AOTA's advocacy efforts at aota.org/advocacy, and also find out more about AOTPAC at aota.org/AOTPAC. All right, let's get going. So just again, as another introduction of how Medicare law is created. So first and foremost, this bill, it has to be introduced into Congress. And when I'm talking about Congress, I'm talking about the United States House of Representatives and the United States Senate. People then lobby for or against the bill, which is part of the federal affairs team's job, where they have lobbyists that work on behalf of occupational therapy to promote the bills that we want to pass and also to advocate against the bills that we don't want to pass. And so they lobby, and so do many, many other groups. And then the House and the Senate both have to pass that piece of legislation, which is no easy feat. And then once it has passed both the House and the Senate, then the president has the opportunity to sign the legislation into law or can veto it. Vetoing it obviously does not allow the bill to finish on into that lawmaking process. So once it has, let's assume the president signs it into law, then the law goes to the Centers for Medicare and Medicaid Services, or CMS. Once CMS has it, the law is then interpreted and put into a proposed rule. So think of Congress as kind of giving the direction of saying, okay, I want you to make a peanut butter and jelly sandwich. CMS then has to figure out how exactly that PB&J is going to be made. So CMS takes that general idea of that legislation and figures out the exact rules and how everything is going to work. And so the law is then interpreted, put into a proposed rule. The proposed rule is released to the public, and the public is given the opportunity to comment on the rule. So every now and then you may see announcements from AOTA asking for a call for comments. And so this is giving feedback to CMS on these different rules that they've put out and saying, you know, either this may work out the way you think it will, or we recommend a change, et cetera. And AOTA is always submitting comments on our behalf as well during these rulemaking processes. CMS then has to read all of those different rules, respond, and then they put out a final rule. And this is what is published and then implemented by clinicians and providers. So that is a bit of a Civics 101, but we will be talking primarily about the kind of steps 1 through 3. So the legislation we're talking about today is all currently introduced in Congress. So some quick facts. We are currently in the 117th Congress. We just are going to be entering the 118th Congress in January. So every 2 years, Congress completely starts over because that's every time the House is reelected. So the House of Representatives has a 2-year term versus the Senate has a 6-year term. And so every 2 years, we get a new Congress. And so every 2 years, every single bill that didn't pass in the previous Congress now has to be reintroduced, which slows things down a little bit, but also explains why we're in such a crunch to try and get this legislation passed. Because if this legislation doesn't pass before the end of the year, we have to get it reintroduced, which not that it's a big problem, but it does take some extra time. So House is likely to flip to a slim Republican majority. I believe it was recently announced that Republicans do now have officially a slim majority in the House of Representatives. And then Democrats are most likely going to retain control in the Senate. They have 50 seats. And then there will be a runoff in Georgia to determine if the Democrats will have 51 seats or if it will remain a 50-50 split. So key groups that we're following, especially when it comes to Medicare policy, is that within the House of Representatives and the Senate, there are committees. And these committees here, so a bill is introduced and then it's assigned to a committee. And so a committee is a way of getting through these legislation faster, and they're all kind of focused on a specific topic. And so you'll notice that when we have legislation introduced for occupational therapy, it tends to be in these committees, and it tends to hopefully be sponsored by someone who is on that committee. So we have the Energy and Commerce Committee, or the E&C committee, that we follow in the House, as well as Ways and Means. Those are the two primary for Medicare policy. And then in the Senate, we have the Finance Committee, obviously a very powerful committee, deals with a lot of finance, a lot of money. And then we have the Health, Education, Labor, and Pensions Committee, or HELP. So for home health, we'll start with the WHIN, the Medicare Home Health Flexibility Act. So this allowed occupational therapy practitioners to initiate and complete the comprehensive start of care assessment in home health. So part of that OASIS start of care. This language was included in a bill in December of 2020. So OTs are officially able to initiate the start of care OASIS in therapy only cases. And this should say January 1st of 2022. So even though the rulemaking happened during 2021, that's a typo on my side. So we'll go ahead and start off with the WHIN of home health. So Medicare Home Health Flexibility Act was a piece of legislation that we had introduced for a number of years, but this would allow occupational therapy practitioners or occupational therapists to initiate and complete the comprehensive start of care assessment in home health. This language was included in a bill in December of 2020. So this bill was passed, or technically the Medicare Home Health Flexibility Act wasn't passed itself. It was included in a larger bill, which is pretty common. So this language was included and it did pass in December of 2020. And so occupational therapists are officially able to initiate the start of care OASIS and the rest of the comprehensive assessment in therapy only cases as of January 1st of 2022. This past year. And so the public health emergency, though, does still allow OTs to initiate the OASIS in all cases. The public health emergency is currently slated to end January 11th of 2023. However, since HHS did not issue a notice that the public health emergency would be ending that time, it'll be renewed for another 90 days, bringing us out to April 11th of 2023. So what's next in home health? Trying to get a qualifying benefit. So AOTA is working to introduce a bill to establish occupational therapy as a Medicare home health qualifying benefit under the Medicare Part A plan. So if you're familiar with this, what this means is that currently, if occupational therapy is the only discipline on the order, when let's say a patient discharges from the hospital to home health, if OT is the only discipline and included on the order, then the patient is not eligible to receive that service covered under the home health benefit for Medicare Part A. We may be a qualifying service for Medicaid or other private insurers like Medicare Advantage. However, under Medicare Part A, we are not a qualifying service. This has been an issue for a very long time, for at least over 30 years, and it does require a legislative fix. So it does have to go through Congress. So AOTA is currently working on making us a qualifying benefit, which means we have to introduce legislation. So this would allow the need for OTs alone would qualify for someone for home health. And this will most likely be introduced in the 118th Congress. So AOTA has been working on getting a score for this piece of legislation to kind of understand how much it's going to cost, because every time you add a new benefit to Medicare, it does tend to cost money. So Congress has to figure out how to account for that. But we can expect this piece of legislation hopefully coming up in the next year. So this will be very exciting and a big win for home health OT. Telehealth, always a big conversation, but we've gained a lot of ground in the last few years. So even though the COVID-19 pandemic brought a lot of tragedy, it has at least been a good opportunity for occupational therapy services when it comes to Congress and expansion of services. So Medicare Telehealth. So previously, before the public health emergency, occupational therapy was not a covered benefit under telehealth for Medicare beneficiaries. So OTs are eligible to provide and bill for telehealth, but only under the public health emergency. So once the public health emergency ends, before this next legislation I'll talk about, the benefit of OT coverage for telehealth completely ended in Medicare. Now, Congress has already passed legislation to extend this coverage by 151 days, which if you do the math, that's about 5 months. So once the public health emergency ends, you add an additional 5 months, and then the coverage for OT services under telehealth also ends once that expires. So we're looking for a permanent solution, ideally. So the fact that OTs were even included in that legislation that extended the coverage for 5 months was a huge win. It has not been guaranteed that OT was in. Oftentimes we'd actually been forgotten or completely left out of the bill. So the public health emergency really demonstrated the value of occupational therapy. It also didn't show that there's been large abuse of telehealth like it was previously thought. So the fact that OT was included in this bill is a result of a lot of advocacy and support. So the fact that we were there is already a big victory. But we do need Congress to make OT a permanent telehealth provider. And again, this does require congressional action. CMS cannot make this decision on their own. So what's likely? Well, we're hoping for legislation to extend through the end of 2023. So again, still a temporary fix, but that buys us another full calendar year to try and advocate for a more permanent fix to telehealth. So we are hoping that we will at least be guaranteed through the end of 2023, which would give a lot of providers and practices a lot of that comfort and relief that we can continue to provide telehealth, but we shall see. And so then obviously we would love to have a permanent fix. Now for workforce diversity, this is another bill that's been around for a little while, is the Allied Health Workforce Diversity Act. So the Allied Health Workforce Diversity Act, what it does is it creates an $8 million grant for HRSA for the higher education to attract, recruit, and retain students who are underrepresented in OT, PT, speech, audiology, and respiratory therapy, or your allied health. So Dr. Victoria Garcia Wilburn, who's a member of AOTA's board of directors, did testify on behalf of this piece of legislation to the Energy and Commerce Committee. So it was a very exciting opportunity. And she was also recently elected to Indiana State House. So also another demonstration that occupational therapy practitioners are great advocates and able to get involved in Congress. And so this is a really important bill because we know, and there's plenty of studies that show the more diverse a profession is, the better care that patients receive. And so having a grant like this would really allow these allied health professions to reach out to more individuals who are underrepresented and bring them into the profession. So not only does it improve the profession, but also improves patient care. So this bill did pass the Energy and Commerce Committee unanimously, so it is now eligible for a vote on the floor. So it's very exciting and not very common that bills receive unanimous support. And it was included in the larger bill for the Senate, the Prevent Pandemics Act, I believe. And so it is included in that bill. So now we just need to have Congress find a way to agree and make sure that it passes through that bill. So again, we are hopeful that this bill will pass this year. It has its best chance so far, but it really depends on what Congress will do at the end of the year, whether or not this bill will be included. But again, one that AOTA continues to advocate on behalf of, do a lot of work to support. It's been introduced in the past few Congresses, and hopefully it'll pass this year. Another big topic is obviously our cuts to OTA payments under Medicare, or also known as the Occupational Therapy Assistant Payment Differential, or OTA payment differential. Now, this does affect PTAs as well, but since we're all here about amplifying OT, we're going to be talking about OTAs. So there is a piece of legislation introduced in order to mitigate the effects of the payment differential, and it's called the Stabilizing Medicare Access to Rehabilitation Therapy, or the SMART Act. It's only introduced in the House, which is fine, but it's HR 5536, and that's the bill text numbers. So it stands for House of Representatives, and then it is the 5,536 bill that was introduced in the House. So the 2018 Bipartisan Budget Act reduced payment for services provided by OTAs and PTAs under Medicare Part B by 15%. And this went into effect of January 1st of 2022. Now it is 15% of the 80% that Medicare pays. So if you remember Medicare Part B only covers 80% of the service, and the patient has a 20% coinsurance. So 15% of the 80% reduction results in an overall 12% reduction. So while the same service provided by an OTA would be reimbursed at 100%, or by an OT would be reimbursed at 100%, the service provided by the OTA would be reimbursed at 88% of what the OT was paid. So again, this payment differential took effect in January 1st of 2022. We've been using the modifier since 2020, but it didn't carry that payment differential until this year. So AOTA has developed legislation in collaboration with APTA to mitigate the effects, which is the SMART Act. So the SMART Act, what does it do? It provides exemptions for medically underserved and rural areas. So this would basically say that the OTA payment differential and PTA payment differential would not apply if a place is registered as either a medically underserved or rural area. It would also aim to delay implementation. However, if the bill were to pass this year, that language would likely be removed because it has already been implemented. So this bill was introduced in December of 2021, so just before the payment differential was took effect. So this language will most likely be removed because it's already been implemented. It also aims to standardize supervision. So it would repeal direct supervision requirements for OTAs in private practice. So currently in private practice, OTAs and PTAs have to receive direct supervision, meaning that the supervising OT or PT has to actually be in the clinic. Now, again, there are some waivers in effect for the public health emergency that allows general supervision to be provided instead of direct supervision. But again, that is only temporary. This would be a permanent fix. So the requirement of direct supervision for OTAs in private practice is stricter than what's required in 49 states. I believe Kentucky is the only state that requires direct supervision. AOTA believes that this direct supervision requirement devalues the skills of OTAs, and it also decreases flexibility for small businesses. So especially some of those private practice or those mobile Part B providers, it's very difficult to employ an OTA because you're not able to comply with the direct supervision requirements if you're in those settings. So how much would these exemptions cost? So total spending in 2021 for OTs under fee for service. So places classified for rural and or medically underserved areas is $241,000, or sorry, $241 million. Places classified as rural and medically underserved. So when we're talking about that Venn diagram, if you have rural and medically underserved as and or, that is at $241 million.
Someone's at the entryway doorbell.
So how much is this bill going to cost? So for total spending in 2021 for occupational therapy services and under fee for service, so you're going to see two different numbers for the rural and medically underserved. So if you're looking at a Venn diagram, this first number of $241 million is the entire Venn diagram. So you have rural and medically underserved, and it's including both circles. So places classified as rural and medically underserved spent around $241 million for OT under fee for service, versus places classified as rural and medically underserved. So that middle part of the Venn diagram is around $73 million. So that's for 1 year spending. So how much would the exemption cost? If we included both rural and medically underserved, it would cost, so added additional cost to Medicare, around $128 million for 1 year. Versus if we included both rural and medically underserved, that middle part, that would be around $37 million. So if it was a 10-year exemption, between 2022 and 2031, it would be an estimated of $1.57 billion if we included both rural and medically underserved, or if we just did the overlapping part, that would be around $454 million. So these are big numbers. What about supervision? Well, supervision actually saves money, and here's why. So studies suggest that reducing supervision could increase the use of therapy assistants, so OTAs and PTAs, and a potential increase in service utilization. It is estimated that if there was a supervision change, 461,000 services would shift from an OT to an OTA, and 5 million services would shift from PT to PTA. So meaning that a service that is already being provided by an OT would most likely shift to an OTA, and that would be around 461,000 services a year, or 5 million for PT and PTA. As a result, this would be a net savings of $1.5 million for Medicare spending, or a net savings of $14.5 million for PT. So the reason why it's a savings is because of that payment differential. So if something shifted from an OT to an OTA, the payment differential would apply under that Part B setting. And so therefore it would be saving money if more services shift from the OT to the OTA. If changes are only happening to supervision, it would be a savings of $7.3 million for 2023, or $271 million over 10 years for occupational therapy. And so that means if the bill were to pass, if they removed the exemptions and only passed the supervision change, this is how much money it would save the federal government. So this is some interesting pieces of information on why this bill is important. And so the state variations in percent of OTA staffing minutes ranged from as low as 20% in Alaska to as high as 67% in Ohio. So what these next few slides are talking about is how important occupational therapy assistants are to our Medicare beneficiaries and our healthcare system overall. So about 20% of therapy minutes in Alaska are provided by OTA, and this is in skilled nursing facilities, and 67% of therapy minutes in a skilled nursing facility in Ohio are provided by an OTA. So it's interesting. So if you're listening to this through the podcast, this would be a good time to go and look at the video on YouTube, because I'm going to have some slides that are showing graphics that obviously I just can't represent in the podcast. But so this is a study that was completed by the Center for Health Workforce Studies at the University of Washington, looking at the OTA workforce specifically in skilled nursing facilities. And this is for data from October of 2018 to September of 2019, based on payrolls. And so as you can see, the darker the state, the higher the OTA percent, and some of the darkest states would be West Virginia, Missouri, Ohio, Nebraska, Oklahoma, and Texas, and those states. And so those are states that have some of the highest utilization of OTAs, versus the lighter color state tends to have lower utilization of OTAs. So assistance provided a higher proportion of Part B services in rural and medically underserved areas compared to all other geographical areas. And so this is a study that was completed by AOTA with Dobson and DeVonzo Health Economics Consulting. And so this was looking specifically at what would be the impact of the SMART Act. And so they looked at some of this data that we fortunately were able to have because of the use of the modifier. So before, there wasn't a really good way to differentiate between when an OT and an OTA provided, or at least there wasn't an easy way to differentiate between when an OT versus OTA provided a treatment or an intervention. But now that we have the modifier, it becomes much easier to extract that information from claims. So this is looking at Part B services specifically. And if you didn't know, SNF is actually the largest biller of Part B services. We tend to think of it as outpatient or private practice, but skilled nursing facilities are actually the largest biller of Part B. So in Part B services, the number of assistants who provided services. So in a rural and underserved area, 58% of therapy services are provided by an OTA in rural and underserved areas, versus only 51% is provided by an OTA in all other areas. Same thing in private practice, 11% is provided by OTAs in all areas, versus 19% is provided by OTAs in rural and underserved areas. For all of Medicare Part B, 24% of OT services are provided by an OTA in all other areas, and 36% of services are provided by an OTA in rural and underserved. So this is a huge example of the fact that the OTA payment differential is really hitting rural and underserved areas significantly more than urban areas, because we rely on OTAs significantly more in these rural and underserved areas than we do for OT. So this is a good graph showing the number of Medicare beneficiaries that are enrolled anytime in calendar year 2021 by state, by rural and medically underserved areas. So it can help you see how much your state would be affected by the payment differential, because you can look at how many Medicare beneficiaries are enrolled either in a rural or medically underserved area. So some rural areas are also medically underserved, but there are some medically underserved areas that are not rural. So I went ahead and pulled out one state. I pulled out North Carolina because this is where I live. And so in North Carolina, we have a little over 2 million Medicare beneficiaries in the state. 23% of them live in a rural area, 49% of them live in a medically underserved area. The individuals who are living in either rural or medically underserved areas is 53%. So 53% of Medicare beneficiaries in North Carolina live in a rural or medically underserved. The individuals who live in both, so a rural area that is classified as medically underserved, is 19%. So the payment differential obviously impacts North Carolina quite a bit because of how many beneficiaries live in a rural and underserved area. So this is a great graph showing that therapy staffing minutes per resident day in skilled nursing facilities decreases as rurality increases. So both by total therapy and by each provider type. So let me say that again. Therapy staffing minutes per resident day in SNFs decreases as rurality increases, meaning that patients in rural areas receive fewer therapy minutes than if they were in an urban area. So the average OT staffing minutes in SNFs located in isolated, small, and rural communities is 45% lower than the average OT staffing minutes in skilled nursing facilities located in urban communities. For PT, it's 29% lower. So these patients are receiving a lot less therapy than others. And so if we're looking at the graph here, so it has 6 different lines. The blue is representing OT. The green is representing PT. And so the light blue is the OTA minutes, the medium blue is the OT minutes, and then the darker blue is OT and OTA. And so if you look in an urban community, on average, 6 minutes are provided by an OT. OTA, 5.7 minutes are provided by an OT. So definitely more reliant on OTAs, but it's a much closer mix. Versus if we go to a small rural community, 4.5 minutes of those services are provided by an OTA versus only 3 minutes are provided by an OT. So a much bigger difference when we're looking at these rural communities in terms of how many minutes they're getting specifically by an OTA. So this graph is showing you that we rely much more heavily on OTAs in these rural areas across the board, especially in SNFs. And then same thing, we're showing the same information for PTAs. And if you look at that overall difference, right, in the urban communities, these individuals are receiving on average around 11.7 minutes of therapy versus in these isolated rural community or of occupational therapy versus in these isolated rural communities, they're receiving about 5.8. So that's a pretty big drop off for those individuals. This is another great graph. So this looks at therapy staffing minutes per resident day in SNFs generally decreases as a level of socioeconomic disadvantage in the community increases, both again by total therapy minutes and by each provider type. So very similar graph, same coloring, but OTA staffing minutes decreases by 0.4 minutes across the social deprivation index, whereas OT staffing minutes increases by 1.4 minutes. PTA staffing minutes decreases by 1.1 minutes across the social deprivation index, whereas PT staffing minutes decreases by 1.8. So this is again where if the OTA staffing minutes decrease by only 0.4 and the OT staffing minutes decreases by 1.4, that means that again, we are relying much more on OTAs in these socioeconomic disadvantaged communities than we are relying on OTs, and same thing for PTAs and PTs. So once again, this is showing the extreme importance of occupational therapy assistance in rural and socioeconomic disadvantaged communities. So I find all of this data really fascinating. AOTA has a fantastic resource really walking through all of this information. So if you go to the aota.org/advocacy page, scroll down to the bottom and click on the additional news, you should see an article in there that goes through some of this information more. I really encourage you to read the report. It's really fascinating, especially if you're an OTA, and really shows the importance of occupational therapy assistance in our profession and to these Medicare beneficiaries. So this is all really important data that we're able to show to Congress about not only the importance of OTAs, but also the damage that these type of payment differentials but also shows the damage that these type of payment differentials have on individuals living in a rural and medically underserved area, because it's having a increased impact. So if it's more split, right, between an OT and an OTA in an urban area where it's more kind of 50-50, it's still going to have an impact, but it's not going to have as big of an impact, because then maybe we can rely more on the OT. Versus in a rural area where there's a lot more OTAs than there are OTs, that means those rural facilities are having a lot more of their income cut than those urban communities. And so we know decreased revenue, right, often means decreased services. So this type of payment differential applied across the board is hurting Medicare beneficiaries more in these rural and underserved areas than in these urban areas. And that's the kind of information that Congress wants to see, and hopefully information that they'll listen to and that we can get this kind of exemption passed. So now to more cuts is the Medicare physician fee schedule, a ghost that haunts us every single fall. So the Medicare physician fee schedule applies the fees for Medicare Part B. And so under Medicare Part B, under the fee schedule, occupational therapy services have only received a 2% increase since 2016, which is obviously not the same as the amount of inflation since 2016. So the reason why we continuously tend to see cuts and we don't really see reimbursement. So on to more cuts is the Medicare physician fee schedule, something that haunts us every single fall. So the Medicare physician fee schedule sets the fees for what Medicare will pay under Medicare Part B. The Medicare physician fee schedule has only received a 2% increase since 2016, which is not equal to the amount of inflation that we've seen. And also what makes the physician fee schedule difficult is that there's a budget neutrality requirement. So basically, if they increase payments for one area, they must offset that increase with cuts. And this is determined by a formula, not a policy. However, unfortunately, they tend to make increases for other services, and occupational therapy typically tends to be the one that receives the cuts, along with many other professions. So we are facing definitely cuts for Medicare Part B, which we'll talk about. And then we also have another cut that we're looking at for all of Medicare. So this includes all of Medicare Part A and Medicare Part B. And this is an automatic cut to pay for other congressional policies. So this is kind of a budgetary gimmick thing where they passed a large spending bill. And in order to kind of automatically offset that spending bill, there is an automatic kick in of something called a pay-go. So what this pay-go is, it's a 4% across the board pay-go cut. You may remember something similar to that as kind of a budgetary gimmick with the sequester. So there was a Medicare sequester, and that went into effect over the year of calendar year 2022. So we had the 1% payment sequester. So that's across all of Medicare that started, if I remember correctly, like April 1st. And then we had the 2% kick in July. So basically what that means is, let's say you get your payment for Medicare, you get a -2%, and then that's how much you get paid. This would be an additional 4% on top of that. So you would see your Medicare payment, you would see -2% for the sequester, and then you would see a -4% for the pay-go. Now, Congress can waive this automated cut, and we do have high hopes that they will waive this cut. So hopefully we will not be seeing a 4% across the board cut. But so those cuts are in addition to the fee schedule. So here's a lovely graph that kind of helps explain it. So over the past few years, so this starting in 2021, assuming that Congress does nothing and all cuts go into effect as they currently are written, we would be looking at a 12.25% overall decrease in therapy reimbursement, OT reimbursement under Medicare Part B since 2021. That's a pretty big cut. But when we look at occupational therapy assistance, we were looking at a 27.25% overall decrease since 2021. And part of that is because of the 15% decrease implemented in 2022. That's why the payment is so different. So we did have a 3% cut in 2021. AOTA did advocate against that cut, but unfortunately, we can't control Congress or Medicare. So that 3% reduction did go into place. In 2022, there was a proposed 3.75% reduction that was as part of the Medicare physician fee schedule. This time, Congress did take action and they passed a temporary 3% increase in overall spending to the Medicare physician fee schedule. So instead of receiving a 3.75% reduction in 2022, we received only a 0.75% reduction in 2022. Now in 2023, that temporary 3% increase expires. Plus, Medicare put on an additional 1.25% decrease. So that compounds to make a 4.5% decrease overall. So because that 3% is expiring, plus an additional decrease for increased spending somewhere else. And then you add the pay-go on top of that. So if you're doing the math, that's 3% in 2021, 0.75% in 2022, a 4.5% for 2023, and then the pay-go, which will be implemented in 2023, which would overall provide a 12.25% decrease in occupational therapy reimbursement since 2021. So not great. And this is why we're advocating for permanent reform of the Medicare physician fee schedule. So what are we doing? Fighting the cut, again, an annual tradition. So a large coalition of healthcare providers is working together to fight these cuts. So first of all, Congress has to waive the pay-go. That's something that they are advocating for heavily because a 4% reduction is massive. I don't think there are very many of us that would be happy with a 4% reduction in our overall payment. And then you compound that, especially across these larger payment healthcare systems, and that's a huge amount of money. That's jobs, that's supplies. We also want to stop cuts to Medicare payments. So overall, we want permanent reform for that Medicare physician fee schedule, and we need to increase the amount that the physician fee schedule can spend in order to account for inflation. And again, this is not something that CMS can do on their own. It requires congressional action. So Congress has to agree to allow CMS to spend more money than what they currently have. And then obviously, we need to work on developing a long-term solution. Now, this is something that does have bipartisan support. So a bipartisan letter with 46 senators, all the way from Rand Paul to Senator Elizabeth Warren are on this letter. So you can see it has quite a large gap of bipartisan support. And this letter was asking leadership to address the Medicare payment cuts before the new year. So asking for action before December 31st. And they also want to investigate sustainable changes and as well as a quick fix. So we really need a quick fix now, right? We have like a month and a half left before the new Congress. And so we need a quick fix, but then they also want to investigate that sustainable change going into the future. So overall, asking for a lot of reform of the Medicare physician fee schedule. AOTA is advocating a lot for us on behalf of this because obviously it is very difficult to both maintain your staff and pay them more, which many therapists are asking for, and rightly so to a certain extent, but it becomes very difficult for facilities to justify spending more on therapists when they're actually receiving a cut for the services that they're providing. So AOTA is advocating on behalf of this as well as the other healthcare professionals, and hopefully we will see some action before the end of the year. Another bill that we have is the OT Mental Health Parity Act, which is Senate Bill 2712 or 2712. So that's bills only introduced in the Senate. And this is building on success that we've seen in other states in terms of Medicaid. So what's important to know about this bill is that overall, this is just asking for clarification on the coverage of occupational therapy under Medicare and Medicaid programs. So this does not at all change what is already covered. So occupational therapy is already covered under Medicare to provide services for those with a psychiatric diagnosis, and they're often covered by Medicaid. So Indiana and Nevada released bulletins that clarified that their Medicaid programs do reimburse for OT mental health services, and so now we're asking for HHS to do the same thing for Medicare. So what this bill would require is that the Secretary of HHS or Health and Human Services provides education and outreach about Medicare benefit policy manual regarding occupational therapy for substance use or mental health disorders diagnoses using applicable healthcare common coding systems or HCP-CS codes, which is often used for often a term that Medicare uses for CPT codes. So this is also asking for some education as well for applicable Medicaid programs. So once again, this bill does not change anything about what's covered. It only clarifies what's already covered. So this bill is supported by Senator Maggie Hassan, a Democrat from North New Hampshire, and then also Senator Tim Scott, a Republican from South Carolina. So very exciting to have them supporting our bills. And so it does have bipartisan support. So again, it requires HHS to provide that education and issue those guidance to states that they may cover OT services furnished to individuals under the Medicaid program for treatment of substance use or mental health disorder. This bill has already had its intended effect to a certain extent of being able to say, hey, Congress is recognizing that OTs can bill for these services, because even though we can bill for them, sometimes claims are getting denied. So this bill is already a success, just the fact that it's been introduced at all in Congress. So we are hopeful that it will pass, but already it's had a good effect in reminding people that occupational therapy practitioners are eligible to bill for these covered services. So what's going to happen if we're feeling lucky? So we have a good chance of seeing the 4% pay go delayed, most likely for another year. So they're going to kick the can until 2024. So check or till the end of 2023. So check back then. We also are likely to see a Medicare physician fee schedule increase, at least temporarily. We are hopeful that the Allied Health Workforce Diversity Act shall pass, as well as the OTA supervision change. And then hopefully we'll have telehealth until 2023. That is a pretty big win to be able to have potentially all of those factors included in the end of the year healthcare bill. So again, that's a 4% pay. So what has a good chance of passing right now, obviously can't make any promises, but hopefully we'll see a 4% pay go delay, a Medicare physician fee schedule increase, an Allied Health Workforce Diversity Act passed, an OTA supervision, and telehealth until 2023. What we might see, it's a strong maybe, is a rural health exemption. So this is where they kind of would pick and choose pieces of the SMART Act. So we'll hopefully have a good chance of seeing the OTA supervision change, which would obviously be huge for these private practices and small businesses. We might see an exemption for rurals. To be determined is the Lymphedema Treatment Act. So this is allowing Medicare to pay for garments for patients. So that bill has, again, been around for a while, but it also has hopefully its best chance of passing this year. So we shall see if it's included in that year-end package. Unfortunately, what we most likely will not see before the 118th Congress is permanent telehealth expansion. That's a bill that costs a little bit more money, requires a bit more time. And so we most likely will not see a permanent telehealth expansion this year. We also will most likely not see permanent Medicare physician fee schedule redesign. That's, again, something that's going to take a lot of time and investigation. And we most likely will not see an exemption for medically underserved areas. So we might see a rural exemption, but unfortunately, most likely will not see a medically underserved exemption. So what are future actions? Our future action is adding OT as a qualifying service for Medicare home health cases. So you're going to be seeing information about that. Investigating the ability for OTs to opt out of Medicare. That's something that we're looking at that's especially important to some of our private practice providers. Looking for a permanent telehealth expansion, and then continue to support other bills that may not pass this year. So AOTA's advocacy page is a great place to look for updates. AOTA is currently running a November Take Action Month, and so they're asking you to contact your legislators. So again, that URL is aota.org/advocacy. Also, though, if you go to the aota.org website, you will see at the top, if you're on your browser, an advocacy tab, or if you go to the menu, you should also see an advocacy tab if you're on your mobile phone. So you can find information about AOTPAC, you can find information about advocacy updates, the Take Action page, as well as one-pagers that you can share with your legislators. So what can you do? First of all, I always encourage everyone to be a member of AOTA. I consider my membership, and again, this is not endorsed, it is just my personal opinion, that being a member is your way of investing in your career. I say that it's my way of making sure that I can continue to be an occupational therapy practitioner. Because as you can see, without someone continuously advocating on our behalf, we could be in quite a bit of a pickle. If we didn't have someone advocating against these cuts, if we didn't have someone advocating for an expansion, we wouldn't have telehealth. We wouldn't have the ability to complete the start of care in home health. We may have huge cuts that other professions wouldn't see under the physician fee schedule. So I like knowing that someone's full-time job is advocating for my profession and advocating for me to keep a job. You can also contact your legislators. It's super easy. You don't have to call them up and talk to them on the phone. You just use AOTA's form and send them a letter and say, share your story and make sure that they know that it's important to you. And as always, vote. Remember that when you're voting, you're not only just voting for yourself, you're also voting on behalf of the profession. So what can you do? Be a member is the number one way that you can be an effective occupational therapy advocate. And this is not something that AOTA is paying me to do. This is something of my own opinion that, in my opinion, being an AOTA member is the best way to make sure that there is a longevity of occupational therapy. I paid a lot of money to be an OT, and I would like to continue to be an occupational therapist. And so my membership in AOTA supports those individuals that are doing the work on our behalf every single day. I like knowing that for my $200 a year, someone is working to advocate for me on my behalf. And because without this kind of advocacy and lobbying support, we would not have telehealth. We would not have OTs be able to initiate the start of care, right? No one else cares about that besides occupational therapy practitioners. And so that was a really important thing that AOTA supported, right? They're the only group that is there exclusively for the benefit of OT. We wouldn't have we would have more severe cuts than we already have, right? AOTA can't control CMS and Congress, but they can advocate for us. And without us having a voice, there's a good chance that the other voices would have risen to the top and we would have had the brunt of that cut. So without them, we would not have what we have now. We would not have the opportunities that we have now. So first and foremost, one of the best ways, especially if you're low on time, is to be a member of AOTA and support these advocacy efforts. You can also contact your legislators. You don't have to talk to them personally and call them up on the phone. AOTA makes it super easy where they have a take action page. You can also email them just straight to their email address. They usually have a way where you fill out your address and then can send them a form and submit them that way. And of course, vote. Every time that you vote, remember, you're not just voting for yourself, you're also voting on behalf of the profession because Congress has a lot to do with how we practice, right? Congress controls a lot of what Medicare does, and Medicare has a strong influence on what other providers do. And especially if you're working with adults, then you're most likely seeing Medicare beneficiaries. And so it would be a huge deal if we had a bad piece of legislation passed that affected our coverage under Medicare. So it's really important that we're thinking about these things and being involved politically on behalf of the profession. So before we wrap up, I really would quickly want to show you the AOTA Take Action page. The URL is aota.org/take action, and it's super easy to use. So when you pull up the Take Action page, you're going to see here, there's going to be multiple little areas where you can pick which bill you want to contact your legislator on behalf of. So if you want to do the Mental Health Parity Act, the proposed cuts, telehealth, the SMART Act, etc., you would fill out one of those. So let's say we wanted to take action on behalf of the SMART Act. So we would click that one. It pulls up information about the bill. So this is, again, a really great way to learn about what's going on in your area. And then it has an area to the right where you fill out your name. This takes on total like 5 minutes, and you can easily do it from your phone as well. So you fill out your name and address. And you want to fill out the address of where you're registered to vote, which may be different from where you live, especially if you're a student. So fill out the address of where you're registered to vote. You click review your message. It'll auto pull up a form letter. It's heavily encouraged that you edit it. So like I would usually edit it to say that I'm an occupational therapist, that I work for X, Y, and Z company. I see these type of patients, and this is how this bill would impact me as well as my patients, right? Your story is really important to share because they know when a form letter is a form letter, but they also know when you're telling your story. So it's important to kind of put in a few sentences about how this bill would impact you personally, and then you just click send. It is super easy, and then you know that you have taken action. So especially for students out there, this is a great opportunity for like a soda party or an advocacy party at the end of a class. You take 10 minutes, you pull up the website and have everyone submit a letter. Professors, I know this is also a very popular assignment to give to students, is to have them submit a letter on behalf of a bill that they're interested in, especially, or if you're working at a company, you can have a luncheon about it and have everyone pull it up and send a form. Any profession can use this page, but obviously the information is written towards occupational therapy, but PTs can use the Take Action page, speech therapists can use the Take Action page, your friend can use the Take Action page. So it's a really easy way to contact your legislators and make your voices heard. All right. And as a reminder, if you don't stand up for occupational therapy, who will, right? We are the only ones who are invested in really invested in making sure both financially and for our life that occupational therapy is here to stay. So if you don't take a stand for OT, then who will? No, that's it. Well, thank you so much for watching and listening to my advocacy updates. I hope you have a fantastic rest of your day and you take action. If you have any questions, don't hesitate to contact me. I'm found at amplifyot.com, or you can find me anywhere on social media at amplifyot_occupational therapy. All right, I hope you all take action, and I'll see you next time.